So, how do you care for your newborn's umbilical stump? Well, that's what we're going to be talking about today. I'm Dr. Obedi of the Newborn Prep Academy, and today we're going to address how to care for your baby's umbilical stump. So first off, what's the umbilical stump? Well, when your baby is in utero or in your womb, they get all their nutrients and oxygen through the umbilical cord, which comes from your placenta through connected to your baby around the middle of the abdomen, right? Or the belly. And when your baby is finally born, they don't need that cord anymore, right? Because now they can take care of their own oxygen requirements, breathing through their own lungs, and they can also take care of their own nutrients by eating and, that being supplied through their own gastrointestinal tract. And so the cord is typically cut off, and the little bit that is left over attached to your baby is what's called the umbilical stump. And this eventually falls off completely, leaving just a depression in the area called the umbilicus. And that falls off, and that could take anywhere from 1 to 3 weeks to fall off. Now, what do you do in the meantime to care for it, to make sure that there are no issues and that it falls off just fine? Well, a couple of things you could do. One is, first of all, to keep the area dry, right? That's the main thing, is you want to keep the area dry and clean. Now, years ago, we used to do, I recommend using alcohol or rubbing alcohol to clean the area. But that's sort of, fallen out of favor because there are some concerns that it may actually end up killing the bacteria, the good bacteria that's necessary to help the area dry completely and fall off. And so it's recommended right now just to keep it clean. It really, at the end of the day, oftentimes doesn't matter what you do, it will fall off and just be fine. So ideally, just keep it clean, keep it dry. You can fold the diaper around that area down so that the umbilical stump is exposed and can dry faster. The other thing you want to do is to avoid getting it terribly wet. And so to clean your baby or bathe your baby during this period, it's best to stick to just giving them sponge baths or using a damp cloth to just sort of clean them without submerging your baby's belly and that whole area in water. Could be safe to get it wet, but the problem is that you end up exposing it to, first of all, being moist, but also potentially getting infected since the area is still kind of very raw. So best to keep it dry, best to just use a sponge bath if you're going to be cleaning your baby until the cord falls up and is completely dry. Right? So that's how you care for your baby's umbilical cord or baby's umbilical stump area. Now, there are times where there may be reason for you to reach out to your medical provider, your pediatrician, whoever is caring for your baby, because you're concerned for some possible infection or an issue in the area. And if there is, it will look like one of these things. There may be some oozing of pus in the area. That will be one sign that there may be an infection. Now, it's normal for there to be a little bit of wetness, maybe a little bit of mucus as it heals, maybe even be a little bit of blood, like a tinge of blood as it scabs up, and sometimes that scab is disturbed and you have some bleeding. But if you have any frank oozing of constant oozing of pus, very foul smell, or redness or swelling around the umbilical stump, those are all signs that there may be an infection. If your baby has a fever, is becoming terribly fussy with all of this and refusing to feed also, all those will be signs to seek medical attention right away. So your provider can take a look at the area and make sure it's not infected, because if it is, it needs to be treated right away with antibiotics. Well, so there you have it. That's how to care for your baby's umbilical stump. Super simple. Keep it dry, keep it clean, and for the most part, you should be just fine. I hope this was helpful. Again, this is Dr. Obedi of the Newborn Prep Academy, and we are here to help you on your journey and to journey along with you as you prepare for your newborn and as you care for them, your recently delivered newborns. That's what we do here at the Newborn Prep Academy. That's my passion. And wherever you're watching this video, there should be links for free resources for you. So go ahead and click on those links. They will be in the descriptions below or in the bio if you're looking at this on social media. And I have a free resource guide to help you choose the right pediatrician for your baby. A really simple 3-part framework you can use. There's also the Confident New Mom resource guide that goes through some really basic things that every new mom should know as she expects to welcome her newborn. They're absolutely free to you. And if you need more support, there is the newborn preparation course, super simple, four module course that goes over all the essential things you need to know to prepare for your newborn. I've been a pediatrician for over 17 years, board certified, and I've cared for thousands of newborns at this point. And so I really kind of distill all the main things you need to know to help you be more confident as you receive your newborn. Well, I hope this is helpful for you. I'll be back again next time for another video. Thank you for stopping by and watching.